Hi, I'm Dr. Harry Lawson, the Chief Medical Officer for SIU Medicine, and today we're joined by Dr. Beau Batton, the Division Chief of Neonatology. So Dr. Batton, welcome.
Hi, good afternoon, thank you.
Today we're going to talk about newborns and maybe even some guidance on premature babies and care for babies and the care for delivery and also even before delivery for normal prenatal care, because obviously that impacts the babies that you're dealing
That's
with,
right.
both in the hospital and outside
Yep.
the hospital.
Yep.
So let's start with just sort of an opening question of what have we done in the hospital environment to make sure that we've put all the precautions into place for patients who have to come in to deliver?
Right. So pregnant women who are contemplating delivery in the near future, I do want to assure all of you out there that all of the regional hospitals have put into place numerous precautions to ensure your safety and the safety of your baby. From screening processes at the time of admission when you arrive at the hospital, safety precautions put in place during the labor and delivery process, identifying any signs or symptoms of COVID or other type of illness in both you and your baby while in the hospital, and being able to provide the necessary care to babies after they're born. These are somewhat scary times, and this pandemic has reached us all. But I do want to assure everyone, particularly pregnant women, that the hospital remains the safest place for you to deliver your baby, and that I am confident whichever hospital that is, you and your baby will receive a high quality care that takes into account all of your health needs.
That's really important, and I want to ask you a more specific question. Perhaps a mother, a currently pregnant patient, is maybe term or even close to term or maybe even preterm, and they're starting to have symptoms. They're starting to feel like there might be something going on. Maybe their delivery is coming early. We know that some patients have been hesitant about coming in. What would you say to those patients?
Yeah. There's been a lot of messaging out there to only come to the hospital if you really need to, but if you're a pregnant woman, at some point you're really going to need to, and so I would urge all pregnant women to contact their obstetrician or OB provider as soon as they have symptoms of concern, even if they think that they are being silly or couldn't possibly be going into labor early or couldn't possibly be feeling right because of a complication from pregnancy. Please contact your OB provider and express your concerns and follow their direction. Complications of pregnancy still happen even in the COVID era, and it's important that they be identified and appropriately treated in a timely manner. So please take these symptoms seriously should they arise, and have a low threshold for contacting your OB provider or coming to the hospital for evaluation if you're worried about an issue related to pregnancy.
Yeah, and thank you for that. And I would also stress that the emergency departments are taking precautions. They have different ways of handling patients who are pregnant, so that you're not in a larger exposed area.
Right. For the most part, a pregnant woman is not going to go to the emergency room, but rather go directly to the labor and delivery department. Unless it's some sort of trauma or non-pregnancy related issue, all pregnant women are being directed directly to the labor and delivery department.
And I think that's important information for people to know, that you're not in that normal big emergency room where you might be exposed to more individuals.
Exactly.
How about, there have been questions about, I've delivered my baby, should I be leaving as soon as I can get out the door from the hospital?
Yeah. So obviously you don't want to be in an environment that puts you or your baby at risk unnecessarily. And even though many precautions are put in place and there's almost no chance of exposure for a healthy mom and a healthy baby, obviously you want to go home as soon as possible. It's important to remember that there are certain standards for when it's safe for a newborn to go home. The newborn must be eating an appropriate amount, not have any breathing problems. We have to be confident that the baby can remain warm in an open crib. And it's important that the baby's weight loss not be excessive or unreasonable. So the usual criteria still need to be met in order for a baby to safely go home. Sometimes that's a day or half a day sooner than maybe in other circumstances or in a non-COVID type of pandemic environment. But much of the time, babies still need to be in the hospital for a couple of days, and almost always for at least 24 hours.
How about in the environment that you work in more often, and that's in the neonatal sort of care unit? So these are babies that have been born that need more intensive care.
Yeah.
What's been done in that environment to make sure that we're being safe?
Right. So most of my work is in the neonatal intensive care unit at St. John's Children's Hospital. We care for about 700 babies a year, and actually we've been quite busy over the last 6 weeks, quite a bit busier than usual. We've put into place a number of precautions. All healthcare providers and all visitors are screened when they arrive at the hospital. All healthcare providers are wearing a protective surgical mask and protective eyewear at all times. And all parents, when visiting babies in the neonatal ICU, are also wearing a protective surgical mask. We're extremely judicious with hand sanitizer and hand washing and good hand hygiene, and have been for a long time, and very proud of our track record there. In the event that we were to have a baby who we suspected could have COVID or was born to a woman who had COVID or was a person of interest, we have a totally separate area with its own negative airflow ventilation for which to care for that infant in isolation, separate from the rest of the NICU. So not only would that baby be safe, but so would all of the other babies in the NICU.
Speaking of babies and COVID, what do we know about babies, especially right after delivery, if the mother was COVID positive?
Right.
What do we know about the transmission of the virus to a baby? What do we know about babies' risks of having COVID? And if they do, what would be symptoms that you might think of?
So the silver lining to all this appears to be that the likelihood of a baby acquiring COVID from his or her mother is exceptionally low. Out of China, there was a case report of, I think, 8 or 9 babies born to women who were COVID positive during the pandemic in January and February. All of those babies were healthy, and they were observed for an extended period of time. A handful of those babies had antibody evidence that they had perhaps acquired the infection themselves. All of them were asymptomatic. And so it appears that the likelihood of your baby getting infected is very, very low. And even in the unlikely event of an infection, the chances the baby would be symptomatic is also very low. Although we still have a number of precautions put in place to cover for that scenario as well.
Another question that we get frequently is not only visitors in the hospital, so grandparents or extended family that want to see the brand new addition to the family, but both in the hospital setting and even when you go home 2 days later, 1 day later. What's our recommendations regarding that?
Right. So all of the hospitals in Central Illinois have modified their visiting policy for all patients. That's affected the neonatal ICU in the sense that we're currently only allowing the parents to visit, or the mother and one self-identified significant support person. Those people are not allowed to visit at the same time, so mom comes in, has her time with the baby, leaves the NICU, then dad comes in, has his time with the baby at separate times. Other visitors, aunts, uncles, siblings, grandparents are not permitted at this time, and that's just to minimize the risk of exposure both to the baby, to the hospital staff, to other parents, etc. In general, premature babies are more vulnerable to infections than term babies and adults. And so in general, we advise that when a premature baby goes home, exposure be limited to other people, to adults. We suggest not taking them to large crowds for a period of time, and that anybody who has signs and symptoms of infection sort of stay out of the household until those signs and symptoms have resolved. So for the most part, our advice regarding interactions after NICU discharge is the same. Take the usual precautions, avoid large crowds, wash your hands frequently, everybody, and if somebody has infectious disease type symptoms, fever, runny nose, cough, they should really not be in the same household as the premature baby until those symptoms have resolved.
Yeah, and I think that's really important too. And it's important also to remember that while somebody may not have symptoms right now, we know that people can be infectious for 48 hours prior to having those symptoms. So you really want to limit your exposure to your brand new baby until sort of things calm down, and we know that our community is a lot safer than what it is right now.
Exactly.
I think we've covered a lot of the questions that we've gotten regarding concerns about babies being delivered in the hospital, the environment, and what we've done as precautions. Are there 2 or 3 key things that you would like to, sort of communicate to our patients and the communities we serve about newborns and the care?
Yeah. So the first thing I'd like to say is, if you're a pregnant woman, it's important to get your usual routine standard care. If you think you may be in labor, irrespective of how many weeks pregnant you are, or if you are feeling new symptoms which could be related to an illness and happen to be pregnant, please contact your obstetrician or go to the labor and delivery department of your local hospital promptly. And please be confident and aware that the hospital has taken a number of significant precautions to ensure your safety and the safety of your baby to deliver in the hospital during these difficult times. I still firmly believe that is by far the safest place for the baby to be born, both from a maternal standpoint and a neonatal standpoint.
And we'll add to that if you have follow-up visits after your delivery, after discharge from the hospital, the environment we've created in our outpatient clinics is just as strict, just as many precautions have been put into place. Everyone's wearing a mask. We're screening at the entrances. We're making sure everybody is well protected and that we're taking all the precautions necessary to make sure if you need a follow-up visit, we want to see you too to make sure everything's going well.
Exactly.
Well, Dr. Batton, thank you so much for joining us today.
Thank you. Appreciate the time.
And we'd like to thank everyone for watching the video. And as always, stay well, stay apart, and wash your hands. Thank you.